Claudia. I'm a registered physiotherapist with Proactive, and today I want to teach you an exercise for pelvic tilts during pregnancy. Pelvic tilts are important because they're going to allow for better mobility during your daily activities, your sport activities, and also during labor. The main idea is to make sure that you're able to tuck in tailbone and lift the tailbone to the back of the room. You can feel this either having your hand in the front and the back or on the sides of your hip bones. You want to feel that the hip bones are going forward and they're going back. These movements are going to allow for a better delivery. If you also add some external rotation and internal rotation exercises. Now, you're going to grab a ball that allows you to have your knee a tiny bit lower than your hip. For me, this is a little bit high, so it's not going to allow me to do a lot of the anterior pelvic tilt, where my bone kind of face a little bit more forward. Now, what we're going to do is have our legs hip width apart. We're going to start with neutral exercises, meaning knees just straight forward. For these, we're going to try to draw an 8. So we go in one direction, and this is going to allow us to have that mobility of the pelvis. Now, if you want to work on external internal rotation, legs in, and we can do the same, and legs out for external rotation, and we can do the same here. You can do 10 in one direction, you can do 10 in another direction. You can also do some pelvic tilt forward and back. For that, you wanna sit up straight, take your tailbone and lift it to the back of the room, then roll your sit bones without looking down, and you wanna continue moving back and forth. Okay? You can do the same, knees in, and you can do the same, legs out. See which one feels more comfortable and work on the opposite to make sure that you make your hips and your pelvis a little more flexible. You can also do circles, and for the circles, it's the same principles. For internal rotation, neutral, and external rotation. This is gonna modify the mobility of your pelvis, and it's gonna make you feel more comfortable with your daily activities until you go into labor. And labor also is gonna feel easier to position your legs according to how it's progressing. Okay? If you have any question or if you feel any stiffness in these movements and you require for someone to actually work a little bit one-on-one with you, give us a call.